This is Ida. This is Truls. And just like that, Ida was pregnant. This should be the beginning of a happy and exciting time. But for some, it can also be the beginning of a period filled with functional limitations and pain. One day when Ida is out jogging, she feels a sudden severe jolt of pain. She can barely continue. Over the next few days, the pain comes and goes, often getting worse over the course of the day. Everyday tasks such as hoovering, sitting still or heavy lifting can provoke the pain. When she's in so much pain, it becomes difficult to function normally in everyday life. Ida has pelvic girdle pain. Many probably know this type of pain under the name pelvic instability, but that name can be misleading as the pelvis has very little movement. In all pregnancies, a hormonal process occurs, making the ligaments more elastic and the pelvis more flexible. But this should normally not be painful. Everyone can get pelvic girdle pain. Women who are highly active, minimally active, and also men. But it's most often pregnant women who are affected. Some women actually realize that they are pregnant because of this pain. International research shows that more than half of all pregnant women get pain in either their back, their pelvis, or both. About 20% get pelvic girdle pain. Studies have shown that pelvic girdle pain can cause bigger problems in everyday life than back pain. Every year, around 60,000 women in Norway get pregnant. Of these, around 12,000 also get pelvic girdle pain. Some women are so affected that they need assistance getting around. Between 2,000 and 4,000 continue to be significantly affected even after giving birth. When the pain first arises, it can be difficult to place its source. Some people go to the doctor and report pain coming from their back or hip, but often these pains can be traced back to the pelvis. The pelvis has 3 major joints. In the back, we find the 2 sacroiliac joints. In the front, the pubic symphysis. The joints are surrounded by muscles and strong ligaments. Exactly what causes the pain is still unknown. It could be anything from a mechanical cause, where the pain comes from the joints themselves, to the hormones that affect the ligaments. The pain may be located over the pubic symphysis, over the sacroiliac joints, or may radiate down the buttocks and thighs. Some people feel pain in all of these areas, others only in one of them. With an aching pelvis and difficulties walking, Ida's pregnancy is no walk in the park. Fortunately, the pain is not necessarily a sign that anything is damaged, even though it can be challenging to live with. There is unfortunately no quick fix for pelvic girdle pain, but there are things you can do and avoid doing to make everyday life a little easier. Some people worry that movement will make the pain worse, so they avoid all activity and wait for the body to heal itself. Others push on with high levels of activity and exercise in spite of the pain. Ignoring the pain completely can lead to overloading of the ligaments and muscles, which in turn can increase the pain. Both of these strategies are likely to make matters worse. The best way to proceed is to keep active within your own pain threshold. There are many different types of exercises and ways of staying active, and none have been proven to have better effect than any others. What is important to remember is that the pain should not increase during the activity. How the activity is performed also affects the pain. Minor adjustments to how you stand, walk, and sit can also ease the pain. Avoid excessive arching of your back or leaning too far backwards. Stand with your weight placed over the middle of your foot. When walking, remember to use your forefoot. Go for 2 short walks rather than 1 long, or walk on softer surfaces rather than hard asphalt. For some, it may be necessary to loosen up muscles and joints that have been loaded too heavily or in the wrong way. It is also important to get good rest between activities. Your body can handle activity better if you take breaks in good resting positions. Resting properly can relieve the pelvic loading and help ease the pain, making it a little easier to live with pelvic girdle pain. Pelvic girdle pain is not a barrier to having a natural birth. And for Ida and most other women, the pain disappears during the postnatal period. Some experience returning pain for a long time after giving birth. If this happens to you, it is important that you set up a good course of treatment in collaboration with a doctor, physiotherapist, manual therapist or chiropractor with the right competence in treating pelvic girdle pain. Research has shown that individualized guidance and treatment can help you to an earlier recovery. Ida, on the other hand, is now pain-free and can begin the process of gradually rebuilding her strength and endurance while resting in between. But the most important thing for Ida now is to take time to enjoy her new and exciting life as a mother.